arrival tomorrow of 300,000 doses of AstraZeneca vaccine to arrive on Friday, July 30th at about 4:30 p.m. On a flight from the UK. And of course, we want to express our thanks to the UK government for this very important contribution to our vaccine response. This means that we are in a position, or will be in a position, to offer vaccines to those who require it, need it, and have not yet gotten, or those who have had the first jab and now require their second dose of the AstraZeneca vaccine. We will immediately begin, once the vaccines arrive tomorrow, to dispatch those vaccines to our regions, to begin what will be a significant national mobilization program around administering vaccines across the length and breadth of our country. And I think this may be perhaps the most significant exercise as it relates to vaccines in our immunization program in recent memory, since we have started this program. We have set ourselves some targets. We want to administer all 300,000 first and second dose by the end of September, with an 8-week gap between the two. And so it's so important that for the first week or so, we move very quickly to administer up to 150,000 doses. It's a very ambitious target, but let us bear in mind that we did deliver 83,000 doses in 4 days with our first blitz. Persons came out, they participated, they cooperated, and the team on the ground did an excellent job, supported by the Army, the Constabulary, volunteers, the private sector. It was truly a collaborative effort. So we have made changes where changes were necessary, and we are now embarking, once those vaccines arrive tomorrow, on a very significant exercise to inoculate a large percentage of our population. There will be no restrictions except for the age of 18 years, which is what is prescribed for the AstraZeneca vaccine. So once you're 18 years and over, you register, and we will allow the system for registration starting at 10 a.m. in the morning. The truth is, we're not going to turn you away if you turn off the vaccination site. We prefer you register online, because that gives us, or by calling the number, 888-1-LOVE, because that gives us some predictability to plan. But if you turn up, we're going to have a holding area. You may have to wait a little longer, but you will get your vaccine based on the quantities that we have. So it's all hands on deck starting Saturday. And this is going to be truly an independence of COVID response, and an independence by vaccination, liberation, if you will, for many. And we want you to look at the holiday period this week coming up as truly an opportunity to protect ourselves, strong-term liberate ourselves, if you will, from the threat of COVID-19 for those who will receive vaccines. Do not hesitate. Avoid the gatherings. There are some restrictions, but you'll be allowed to go get vaccinated. And those restrictions, once you're getting your vaccination, don't apply. You go to the center and you take the jab, and then you return home, even after the curfew hours would have been in effect. The other element of the program is that we will still have some of that. We're going to be mobilizing additional capacity, filtering out through to the health centers and providing that support logistically in the health centers as best as we can, so persons can go to a location that's close to them. We're going to involve the members of parliament, councillors. Minister Mackenzie will be on shortly and will tell us. He will help us to drive that, as he did in the first blitz, the Ministry of Local Government and Rural Development. We will also involve the private sector. And for the first time, the private sector will have an opportunity using private physicians and other clinicians supported by public health to administer vaccines. And they are going to targeting the work environment. So they are collaborating with employers to get employees out at locations that they would have designated and have set up. Today, there was a trial run by the private sector at the Girl Guides headquarters here in Kingston. I visited that location. I think they did about 1,200 or so, which was excellent. We provided the vaccines. We had a few of our public health team there. They had private doctors, and I think it went very well. It was well organized, and I want to commend them for that effort. Peter Meleda will come on later on to give us a synopsis as to where they will go from there. We're going to be mobilizing the churches, community-based organizations. What is very, very important is that we see this effort in the next week or so as truly a national effort, a major national global mobilization effort. And to all those who have been justifiably concerned, including those who were offended sometimes, maybe critical of my tweet earlier today around the statement, "Get vaccination," with an exclamation point. I'm happy that you responded, and I'm saying this is your opportunity to get your vaccines. For all those who said, well, we have no vaccine to get, well, this is your opportunity. Go out, take someone with you, because we want every single dose of the vaccines available to us come Saturday morning to be used up, and there'll be no excuses. Now, clearly, our target is 2 million Jamaicans and more, 2/3 of our population. 300,000 clearly falls short of that mark, particularly because it's a double dose that is required. That's 150,000 Jamaicans. So we're well short, but it is enough if we are to set a target of completion by September, the end of September, for this batch, where we can accommodate a large percentage of the population. And given that we're opening up to everyone, we encourage all to come. Don't worry, because other supplies are coming. We anticipate other supplies in the next week or so. I don't want to give too much details. We have done so already. I think the PS will elaborate a little on that. But I don't want anybody to be waiting on the next batch or the next brand. The cardinal rule to vaccination against COVID-19 is to take the first one you get. And in our case, the value of that principle should lie in the fact that as a government and as a country, we do not accept vaccines that do not go through clinical trials and pass the test for efficacy and safety. That's why we waited on WHO approval, WHO scrutiny, the expert opinion, so that when we say this vaccine is recommended, this vaccine is safe, the country will buy into that and feel no fear that we are imposing on them a risky proposition. So don't wait until other doses come. Take advantage of the AstraZeneca. Incidentally, the AstraZeneca vaccine is the world's most popular now. And indeed, enough time has elapsed to show that it is safe. I took my 2 doses. Many Jamaicans, 300,000 or so Jamaicans, have taken at least 1 dose. And so no one should have any fear about taking the vaccine. To elaborate on the specifics of the plan quickly, I'm going to ask the Permanent Secretary to just outline the vaccine logistics starting on Saturday, the 31st of July, for the Jamaicans 18 years and over. Yes.
Thank you, Minister, and good afternoon, ladies and gentlemen. So just to remind us of the principles of our vaccination program, and that the vaccination program is founded on human well-being, equal respect, national equity, legitimacy, and reciprocity. And these are values that we have adopted from the WHO's SAGE Values Framework. Next. So, as the minister pointed out, we have delivered 307,000 doses of vaccines to the population. And based on that, we have inoculated approximately 179,000, 180,000 persons with one dose and 127,000 persons with two doses. And Minister, as you recall, we did get some vaccines, the Johnson & Johnson single-dose vaccine, through our collaboration with the Ministry of Sports. And those vaccines were administered to some 769 individuals who participated in different sporting activities. So of that, therefore, approximately 128,000 persons across the island have been fully vaccinated. Of that number, the majority, some 48%, are in the older age group, persons who are 50 years and over. However, of the total number of doses that have been administered, females receive more doses than males, and the older age group, again, are persons who have been in receipt of our vaccines that have been administered. Therefore, next. Therefore, just to remind us of the objective that we intend to achieve as at the 31st of March 2022, where 65% of the population will receive a safe vaccine. However, our process right now is to expand our service points, as you have pointed out, Minister, increase the rate of vaccination within the population, and to ensure inclusion of all socioeconomic groups in alignment with our value system. As you have announced, Minister, just now, as at Friday, July 30, 2021 at 10 a.m., all persons 18 years and over can make appointment for vaccination. Additionally, as at Friday, July 30, 2021 at 10 a.m., persons can make appointments for first and second dose. So two points to note. One, persons all of ages 18 years and over can make an appointment going forward as of tomorrow. And two, that you can make appointments for first and second dose of for your vaccination. Minister, the program of supply that we have at this point in time sees us receiving supply from four main sources. The African Medical Supply Platform, as you indicated, will provide us with, in August, 168,000 doses of vaccine. The United States will provide us with approximately 204,000 doses of vaccine in August. And the United Kingdom, as you have announced and has been made public, will provide 300,000 doses of vaccine tomorrow. The United States and United Kingdom are donations. However, our arrangements with the African Medical Supply Platform and our arrangements with the COVAX facility, WHO COVAX facility, are purchases by the government of Jamaica. So overall, Minister, we will have by the end of September a total of 1.4 million doses of vaccine in Ireland to be administered to the population. But we have to, based on our objective, look back at our strategies to ensure that we accelerate our vaccination program, and therefore we have to examine the characteristics of the program to date and provide interventions that allow us to achieve the objectives as we have stated them. So we have to now look at our community-based interventions and how we engage at the local level with communities in their space and in their specific cultural norms and values to provide vaccines. And we also have to ensure, Minister, that we have different service delivery models to ensure that we reach everyone at all different socioeconomic groups. And so our community engagement must seek to engage all our stakeholders, our community mobilizers and activators, the civic organizations, the churches, the political organizations, as well as create different vehicles in terms of how we reach our population. And as such, we have the partnership with the private sector vaccination initiative. Now, this is a partnership between the private sector organization of Jamaica, Jamaica Chamber of Commerce, and the Jamaica Manufacturers and Exporters Association. Next. And this initiative is a partnership of these agencies, these private sector groups, and the Ministry of Health and Wellness in terms of achieving the goals and objectives of the vaccination program. So the objective of the private sector vaccination initiative is around increasing the velocity of vaccination by engaging their particular stakeholders and ensuring that the private sector mobilizes its stakeholders to receive the vaccines. Next. So the initiative works along with the ministry, but in two main work streams. The first being that they organize and develop their own efficiency model, and therefore they engage their own private practitioners to augment the public health system, and also to engage the workforce that they collaborate with to inoculate the target of 600,000 doses being administered through this initiative. Next. So the logic model for them, or the logistic elements for them, include their medical team, the vaccine supplies provided by the Ministry of Health and Wellness, and they identify their own sites, and they must utilize our registration system, the ComCare system that has been launched and that is utilized by the Ministry of Health and Wellness to track and register persons for vaccination. And therefore, their reporting is to the Ministry of Health and Wellness through this solution. And it is good that this solution is being used, because it is through their partnership that we were able to work with UNICEF to properly set up the ComCare solution to deliver vaccines. So where will we be over the next couple of days and going forward in terms of months? So for the Southeast Regional Health Authority, which consists of Kingston and St. Andrews, St. Catherine and St. Thomas, we will be operating through the National Arena, the St. Joseph Hospital, the Mona Aging and Wellness Center, Good Samaritan Inn, University Hospital of the West Indies. In St. Thomas, we'll be at the Morant Bay Health Center. In St. Catherine, we'll be at Old Harbour High School, Old Harbour Civic Center, Dinthill High School, St. Jago Park, Linstead, Ebony Vale, Point Hill, Kidston Town, Browns Hall, and Portmore Heart Academy, all at different times and at different days. And it is through the appointment system. Once you go onto the website and identify when the date that you want to book your appointment, these venues will be shown and you can select the appropriate venue. In the Northeast Regional Health Authority, which is St. Anne, St. Mary, and Portland, The venues are outlined there. In St. Anne, we are going to be at the Otarias Health Center and the cruise ship pier, right there in the center of Otarias. In St. Mary, we'll be at the Highgate Anglican Church, the Port Maria Anglican Church, the Nutter Bay Sports Complex, and in Portland, we'll be at the Buff Bay Health Center, the Fair Prospect Health Center, and the Port Antonio Health Center. In the West, we will be at Catherine Hall, the Type 5 Clinic, Adelphi Health Center. All of these are in St. James. And in Trelawney, we'll be at Falmouth, Duncan, and Alberton Health Center. In Hanover, we'll be at the Lucy, Green Island, Sandy Bay, and Hopewell Health Center. And the venues in Westmoreland as listed there. For Southern region, which includes Clarendon, Manchester, and St. Elizabeth, we will be at these venues outlined on the slide. It include Denby Primary School, Killits High School, Maypen Hospital, Wembley Center of Excellence, Manchester High School, Black River Health Center, Santa Cruz Health Center, Southfield Health Center. So as part of achieving the objective of being in as many locations as possible to create greater access, the ministry through its regional health authorities and through its parish health departments will be establishing several venues through which individuals can access vaccines. So as a reminder, as at Friday, July 30, 2021 at 10 a.m., all persons 18 years and over can make appointment for vaccination. And as at Friday, July 30, 2021 at 10 a.m., persons can make appointments for first and second dose. How to make appointment? Go on our website, www.moh.gov.jm, click on the link for vaccine appointment, provide the required information, follow the instructions, or call the 8881 number or 888-663-5683. Thank you, Minister.
Thank you very much, PS. So there you have it, ladies and gentlemen. We are now in a race. This is Olympic season, so we'll use a terminology to vaccinate as many Jamaicans as possible, to rebalance the scales in favor of having more persons vaccinated than not. There's still some ways to go. It's a distance. But we can do a sprint right now, given that we will have 300,000 doses starting Saturday morning, multiple locations to access, and a mobilization effort with a healthcare team committed, dedicated to the cause to provide the services that every single Jamaican 18 years and older can benefit from. There is no excuse. We all can now take that responsibility, and to do anything else would be to jeopardize your safety and the safety of others. Vaccines are the most effective response to COVID. Of course, the protocols have to accompany that. And until we get most of the population vaccinated, then even those who are can pose a risk to those who are not, which is why we insist on the mask wearing and the sanitizing. Simplify it again, I say, 1.4 million vaccines between now and the end of September. That's the projection. And that is what was planned all along, given the availability globally. Safe vaccines, approved vaccines. More to come after, but we will leave it at that for now, because we do expect to access vaccines in the months beyond that, but we don't want to encourage anyone to wait. A recognition that COVID is still out there, still a threat. There are variant strains that are posing additional risk. We are in an increased outbreak, a third wave, if you will, and therefore there should be some levels of urgency in getting your vaccines to protect yourself and to protect others around you. So go out and get vaccinated starting Saturday. at a location near you. Get registered starting tomorrow at 10 a.m. And if you have questions, call the 888 One Love number, call your local health center. And as we have outlined, vaccination is about getting back to our normal living. And I know a number of Jamaicans are not happy about the fact that there are restrictions, and including the added restrictions announced by the Honorable Prime Minister recently. Well, this is your chance to quickly overcome those restrictions by protecting yourself and, by extension, the community and the society. The mobilization efforts are key. And at this point, Stephen, I'm going to ask my colleague, the Honorable Desmond McKenzie, Minister of Local Government and Rural Development, to come on. He's on. Minister, good evening to you, sir.
Good evening, Minister, colleague, ladies and gentlemen on the platform. It's a pleasure to be joining you at this very crucial time in our vaccination program. I'm actually in Portland, and I have been working on the program, putting together the mobilization through the various municipal corporations. All mayors are on board. The CEOs of each municipal corporation has been contacted. The members of parliament has also been contacted, and we will be intensifying those contacts and mobilization into tomorrow and going into the next 7 or 8 days. We consider our role in this exercise very, very important. And therefore, we are committed, as we did in the previous blitz, to continue our efforts. I want to use this platform to encourage our local representatives at the municipal level. It is important to mobilize their constituents in their respective municipal divisions, and a similar appeal to members of parliament, to ensure that they play a part in this exercise. And to the wider Jamaica, to echo your sentiments and that of the permanent secretary, it is important that all Jamaicans take this opportunity at this time to ensure that they get vaccinated so that the country can return to some level of normal operations over the next couple of months. And I urge my fellow Jamaicans to participate, and I pledge the support of the local authorities and that of the political directorate in this exercise.
Minister, I really want to say thanks to you and to your team. Local government, rural development means promoting health and wellness. Indeed, the parish health committees are lodged within the municipal authorities, and we work very closely together. And, I say to people, politicians perhaps know every crevice and corner of this country for many reasons, including seeking political office. It's an opportunity to leverage that knowledge and those people.
And I think we can rely on that machinery, because we start working in many areas across the country, and we will ensure, we will be working, burning the tires to ensure that we get as much persons vaccinated over the next couple of days.
Thank you very much, Minister, and we appreciate the time that you have taken and appreciate the efforts that you're putting out. Thanks a lot. Jamaica will be grateful forever. All right, there you have it. The local government and rural development on board as they were in the past. This is a major mobilization exercise, and I want to thank Minister McKenzie for that. Can we turn now to Mr. Melhedo, Peter Melhedo. So Peter Melhedo is, of course, the private sector representative on the private sector vaccination initiative. He has worked with us on the software program, which we have put in place to capture the data in real time to ensure that we have accurate data and therefore can drive the policy and the strategy. And now the team at the private sector level are taking on some other work by working to mobilize workers, employees, and setting up sites and essentially managing those sites with some support from public health. So I brought him on just to hear his perspective. I don't think he's in Jamaica, but nevertheless, this is the beauty of technology. The coordination continues. Peter, how are you?
I'm fine, Minister. Thanks for having me. Really appreciate it.
Tell us your perspective.
Yeah, let me tell you a little bit about where we're at. So just saying hi to both ministers on the call, the CMO, the PS, ladies and gentlemen. So as you said, first of all, Minister, I think it's appropriate to start with really a big congrats to the team who I know has worked tirelessly to get the vaccines here in Jamaica. And it does seem like a bit of a feast or famine situation where I think we're now in the feast stage of it. We've been in the famine for a few months. And as you said, you know, you've set some very ambitious targets, but as Jamaicans, we're better at the sprints than the marathons. So perhaps that's appropriate. And if I was to extend the analogy, I would say that, you know, Jamaica is also very good at relays, and I hope that the PSVI, can run a good leg in helping, you know, to meet this ambitious target. So I think the PS outlined pretty much the modalities that we are going to use, so I won't go back over that. But you know, our aim is obviously our primary mandate as a PSVI is to increase the speed and penetration of vaccines in Jamaica, in particular with a particular focus on the productive sector. And what we've been engaged in the last couple of months is really sensitizing our teams that once vaccines arrive, we really have to get out in numbers and make sure that we get jabbed and we also get, you know, so we get to a point where our workforce can kind of go back to that time where we could be in the workplace without fear, you know, for our health and safety. So that's really been our primary objective. And as you said, Minister, the things we're doing are twofold. One is obviously mobilizing our team members to come out, but secondly, working closely with the Ministry of Health to be their agent with regard to maintaining. We're going to probably have 4 to 5 sites in this initial period, and we will staff those sites. We will manage all the logistics, and then we'll have Ministry of Health officials who will be there kind of supervising the clinical side to make sure that we're in compliance with all of the standard operating procedures, which we have, and you know that we're doing all the safe and proper things, following the protocols to ensure that we're really mirroring what's being done at all the other ministry operated sites in terms of public safety. So we had our trial today. We're just wrapping it up. We vaccinated 1,200 folks from the productive sector. We had a tremendous response. We had to really hold the line at 1,200. I think we could have easily outpaced that. And it went really well. I believe, Minister, you visited. I know the CMO and the PS. I believe Dr. Ennis also visited. So, you know, I think we were able to meet the standard, and it bodes well for our you know, commitment down the road to really assist in running a leg of this relay. So we have our work cut out for us. I know you're very keen. We're starting Saturday, so we have a lot to do to get ourselves in position to really contribute to this first wave of vaccinations of the 150,000 that you've set, Minister, to be done by early August. So we have a few holiday weekends, as you said. This is kind of the vaccination independence, but we work through all of that, and we're going to do our level best to make sure that we can run a significant leg for you in this first phase of this 300,000, and then continuing on until we have the kind of penetration among the workforce that will get us, will mirror the herd immunity targets that you've set for the whole country. So that's it in a nutshell, Minister.
I want to thank you, Peter Melhedo of the Private Sector Vaccine Initiative and the Private Sector Group generally. I want to commend you for your leadership. You have sort of kept the strides and going on the efforts, and your team, of course, that have worked with you. I really want to commend you guys on today. I went to the Girl Guides headquarters, and a lot of order, nice lines, patiently waiting people. And on the inside, supported by a few of our public health members, your team were really providing all the guidance with all the facilities that were necessary to maintain the health protocol. So I think you have demonstrated today that you can do it. So we do anticipate that you're going to be doing it in many other places and that your workers, your employees will come out because we do need them. Hesitancy will become an issue at some point. So we're going to depend on the leadership and the influence of employers to bolster the validation and the justification for vaccines. So thanks a lot. I know you're busy at work, so thank you, and we will keep in touch.
Thank you, Minister.
Okay.
I'm sure we'll be in touch. Thank you, everybody. Cheers.
Great.
Bye-bye.
I want to use the opportunity to really recognize the efforts of others who have played a leading role in us having this process starting. Minister Johnson Smith, who is the Minister of Foreign Affairs, Foreign Trade. A lot of the diplomatic discourse is driven through her ministry and herself, and she has really been always available, always there, always putting out a lot of effort. And I really want to just recognize her and her team for their efforts. This really is a collaborative effort. And so I just want to say a big shout out to Minister Johnson Smith and her team. The Prime Minister, of course, was always available, always providing the leadership, making the calls when necessary. I want to recognize him, the Cabinet of Jamaica, for the overall government support. And in our shop, apart from the PSCMO, the regional directors, regional technical directors, the public health team in the field, I want to just recognize the National Health Fund because they have really played a leading role. Chairman Howard Mitchell, who wears a private sector cap also, Everton Anderson and his team, storing vaccines, logistically moving it from one place to the next, providing all the other critical components of the COVID response. I want to just say thanks to the NHF team for the effort. So there you have it, folks. We understand that this is an exciting evening for Olympics, so we're not going to prolong you much further, the event much further beyond the questions. But just to recap, we are now embarking on a new phase. We did say we're pivoting to some extent by incorporating greater numbers of stakeholders, more distribution points to reach more people, greater levels of mobilization, and the ultimate aim is to say to all Jamaica, we are now going into a gallop. This month, which is almost finished, next month, September, October, November, going right down into the end of the year. And we do anticipate that more vaccines will be available. It will now be up to Jamaicans to participate. The wait has been longer than we hoped, but we did anticipate those hurdles. We've crossed them. We have kept, I think, for the most part, the country safe. You have complied for the most part. Now it's time to move into this phase so that we can move quickly back to normality. And so let's get the vaccine, let's get the jab, and let us protect each other and encourage those who may be hesitant. Thank you very much. Over to you, Petre.
The floor is now open for questions from members of the media who we invite to use the raise hand feature in order to be acknowledged. Not seeing any questions. Nobody has any questions. Okay, we have one question from Christopher Thomas. Mr. Thomas, go ahead.
Yes, good evening, Minister, and good evening to your members who are with you. On the issue of vaccination, we know, yes, that the vaccines are on their way, but there's an issue that has arisen very recently that was reported. It was speaking specifically to the teachers in terms of them getting vaccinated, and it may potentially affect other groups. It was stated about teachers who get the vaccine will get preferential treatment, right? As opposed to those who don't. But that has basically stirred up an ant's nest, because some are saying they have underlying issues that may preclude them from taking it, so it would not be fair, and others may choose not to take it for other reasons. So now, with that in mind, it's just been mentioned this evening that several groups may be approached to assist with this rollout of vaccines. But if those groups, or if individuals within those groups say they would rather not take part for whatever reason, what assurance is there that they may not be subjected to a different type of treatment compared to those who do take part?
Okay, so you've asked a policy question, so I'm the man on the bridge right now. First of all, I really do think that the sort of anxieties, if you will, around the response to the comment made by the Prime Minister may be a little overdone. And I say so respectfully to those who have expressed concerns. The fact is that there is going to come a point, once COVID remains a threat, where persons who are vaccinated, as opposed to those who are not, will go through separate terms of engagement or protocols based on the risks that they pose to others. So it's a logical and a fundamental principle. Now, the Prime Minister spoke to teachers, and I mean, there's a context to what he said, and I got the impression sometimes that he was taking out of context in some of the analysis. He will speak for himself, I'm sure, at the appropriate time. But you can't have a society where a clear and present danger represented by a virus, which can claim your life or the life of others, because you spread it, you can move it from one person to the next, and you treat persons who observe the protocols, including take the vaccine, to protect themselves and to protect others around them, whether they're family, community, co-workers, students in school, person at the workplace, and you expect those who don't to be given the exact same treatment. Because effectively what you're doing is undermining the entire process and putting persons at risk who are trying to be responsible about the response. So how does this manifest itself? If you take the vaccine, you represent less of a threat. If you don't, you're a bigger threat or risk. It may mean that you're going to have to be subjected to testing, for example. So you may find a case where if an employee, for one reason or another, does not take the vaccine, they may have to do more frequent testing as part of the overall risk mitigation within that organization. And I'm being very general now, not speaking specifically to teachers or otherwise. So, you know, in terms of the response for clarity on the issue, I want to advance a principle of assessing risk and imposing risk mitigation measures. I was pulled over the coals because I said there is going to come a point when we are going to have to determine by policy, maybe by legislation, how we treat with the virus and with those who expose themselves unnecessarily, or who, worse, expose others by their actions. And I am not resiling from that, because the truth is, you threaten an entire community and society if you are wayward, irresponsible, or don't take the necessary precautions to protect yourself and by extension all of us. And so I don't think it is an unfair or unreasonable comment, to be totally frank. I think though that one may interpret it in a particular way to make it seem harsh. But I do believe that the work environment, whether in the school or in the factory, will have to look very differently going forward as long as COVID remains a threat. The protocols, which we are prescribing, will have to be put in place, which we are enforcing. And part of that protocol will have to be to disseminate, if you will, and assess risk based on those who are vaccinated and those who are not. And I think that is a reasonable principle on which to develop a set of policies and programs. And I don't think anybody should be offended by that, frankly speaking, because it's about how you protect the whole by ensuring that we minimize the risks of individuals to affecting that whole. And I think that's pretty much what the Prime Minister was articulating. Thank you.
Thank you, Minister. Our next question comes from Debbie Ann Wright. Debbie Ann.
Good evening. Yes, I'm not sure whether I missed it, but the CMO said that some hospitals are already over 90% of capacity. What precisely are you doing for those particular hospitals to ensure that you still have space for persons who might become ill in this surge? I think last week it was mentioned that some persons would be discharged. Have you started doing that as yet?
So.
We report on two different occupancies, both the general occupancy as well as the occupancy for COVID. So in terms of those hospitals that are in red alert, you would recall from the figures that were presented, the general occupancies are high, but the COVID beds are not affected. So the COVID occupancy still remains low. So we still do have some capacity to take patients who have suspected or confirmed COVID cases. And as we had mentioned before, we continue to try to increase our capacity in terms of the building out of new field hospitals. We have the Maypen facility that is to come on board sometime, hopefully over the next few weeks. And then we also have the possibility of erecting 2 other field hospitals if it becomes necessary.
Thank you, CMO. Our next question goes to Zara Burton.
Good evening, everybody. My question is for the CMO. I wanted to know, more than 3 months ago in April, you made a commitment to report all side effects after vaccination, including deaths. Now, it's been several months that no reports have come despite your commitment. First question, when will you start to continue to report adverse events post-vaccination, of course, regardless of cause? And why haven't you been reporting adverse events post-vaccination? The third question, given the fact that Jamaican law requires the reporting of side effects of new drugs to the minister, why isn't the public being made aware of the form that's being used to report adverse events in the same way that you tell people to mask up?
I'm going to ask Dr. Ennis to give us a report, an update on the adverse events. Dr. Ennis, can you go ahead with that, please?
Thank you very much, CMO. Good evening, everyone. So we have established what we call an Isabe Committee. This is a committee made up of persons who look specifically at events that are supposedly attributable to vaccination or immunization and These are whatever untoward events, which may include deaths, disability, permanent or temporary, or hospitalization, among a few other things, looking to develop causality or to establish causality. We have to date received 249 Isabes that have been reported across the island of our 305,000 doses of the AstraZeneca vaccine that we have given. We do a classification of the Isabes that we receive, and of the 249, we have classified 46 as serious. Now, the classification that we use is an internationally accepted classification, and being mindful that the persons on the Isabe Committee here in Jamaica have been trained. It is clinicians with expert training in the particular field that we're considering at the time. So we have classified 46 as being serious, and those went through the fulsome evaluation of causality. I can start with the deaths. So we have noted 11 persons that have died after receiving the vaccine. And when we do the fulsome report, we concluded that 9 of those 11 persons, the deaths were coincidental. So it was not caused by the vaccine. Their death would have occurred whether they had the vaccine or not. It was just coincidental, and that was 9. 2 others we have been able to ascertain as being indeterminate. Now, when you go through the form, you look at the level of evidence that shows that a vaccine could cause this illness. And we found that there was no such body of evidence at this time. And therefore, the underlying illnesses that these 2 persons had possibly could have led to their death, and it was indeterminate if the vaccines could have caused it, but there is no such evidence at this time. And that accounted for the other 2. So that's the 11 deaths that we have noted. 9 coincidental and 2 indeterminate. The other numbers that would make up our 46 included things like allergic reactions, and all of those persons who had those reactions have fully recovered. We identified 3 persons who we have recommended, based on our assessment, that they should not receive the second dose of the vaccine. So there may be conditions that preclude you if you had a particular reaction after the first dose. Once that assessment is done, we will recommend that you do not take the second dose. So we have had 3 such persons. I believe that is the extent of our investigations to date. We continue to collect information from the field. We do encourage persons to report. The form you mentioned, Ms. Burton, is actually online for persons to report adverse events. However, we do recommend that persons come into us so that we can assess them, we can allay fears, and treat if necessary. So yes, you are free to report. We encourage persons to report. It is a new vaccine, or these vaccines are new, and we are interested in side effects. We know that some of these side effects are what we expect, but we also know that we have a unique population in the Caribbean, and therefore we do want to report to the international community if there are any nuances within our population. So yes, we encourage persons to report, but we are also saying to you, let us know, and we will do an assessment on the spot, allay your fears, begin treatment, and then forward the documentation to the national level for causality assessment. Thank you.
Thank.
Can I say that earlier I had spoken about the responded to Christopher from the Guinea on the issue of the commentary teachers. And there was a point in his question around persons who may have underlying conditions. I just want to remind him and the populace that there is a protocol around persons who are vaccinated. So part of the protocol is to examine their underlying conditions, to give them an examination if necessary, and to recommend their suitability for taking the vaccines. So clearly, Christopher, I hope you're listening still. No one is going to be forced to take a vaccine if they are experiencing or have conditions that would not serve them well clinically. And there is a process in the protocol that provides that kind of guidance, and that would apply to everyone, whatever profession. We're speaking here of persons who can take it, are deemed to be fit to take it, and who may refuse in an environment where others have taken it, and it then creates a sort of inequality of risk, if you will, which could pose a problem to the general organization. Clearly, the protocols may have to be different depending on the risk profile of those individuals. And I think that's the principle, which I think is a fair one. And indeed, one practiced in most jurisdictions around the world, and getting more so once more vaccines become available. Some people elevating it to the point of legislation. I saw where I think it may have been our neighbors up north, where an announcement was made about federal workers and the requirement for them to either be vaccinated or be frequently tested. That's a difference in policy based on the risk assessment. And so that to me is a principle that can be justified. Thank you.
Thank you, Dr. Ennis. Thank you, Minister. The next question goes to Stevian Simmons. Stevian. All right, we will move along. We also have a question from Ludwig Morris. Ludwig, you have the floor.
Good evening. I'm Ludwig Morris. I'd like to ask two questions. The first one is, in terms of children below 18, what are the plans to get vaccines for those, especially the vulnerable children with chronic conditions? Where are we in terms of securing vaccine for those children? And the second question is, with the current uptick in the cases of COVID-19, does the protocols for those mass events, especially in the western end of the island, will they involve vaccination or having a negative test to attend those events given the current climate? Thank you.
So the children with comorbid illnesses will certainly be given priority when we receive vaccines that are able to be given to the appropriate age group. So we do bear that in mind, recognizing that there are several of our children that are at risk. So, and we will be getting vaccine that is appropriate for that age group over the next couple of weeks. Thank you.
The second question, persons, I wasn't clear, sorry.
Right, so coming up on the weekend, next weekend, there are mass entertainment events that have been approved. For those events, is it a requirement that persons attending those events are immunized or have a negative COVID test, given the current climate in terms of our number of cases?
Right, so there is no, as far as I can recall, requirement in the Disaster Risk Management Act as recently announced for persons who attend events to either be vaccinated or tested. I know that some of these events do place some requirements on testing and on vaccination, but not the government. What the government has repeatedly said is that we should avoid public gatherings, we should minimize the numbers that congregate, we should wear the mask, sanitize, and physical distance. And in a sense, therefore, it is up to those individuals to do those things to offer the best chance of protecting themselves. And yes, when vaccines are available, those who are not should seek to get vaccines. But that's the extent of the advisory, encouragement, and even the law at this point in time.
I gather Minister Mackenzie would like to also comment on this question. Minister?
Yes, the minister has responded in the similar vein that I would have responded. But just to say that in some of these events, the promoters have instituted some of those measures, and also the fact that the capacity has been reduced based on the new order, and that there will be a substantial amount of monitoring, COVID marshals, plus the monitoring mechanisms that we will be putting in place to ensure that there is compliance to the protocols that have been observed. But there is no stipulation within the Disaster Risk Act or in this new set of protocols that have been announced.
Thank you, ministers. Thank you, CMO. There being no more questions for this evening, I turn back over to our minister for his closing remarks. Minister Tufton.
Well, first of all, I'm surprised that person stayed on so long because I know the action is in Japan, and I'm certainly anxious to take in a little bit of it and to wish our team members well, and the Jamaican flag, of course, support with pride. But you know, locally, we have to keep reminding ourselves that COVID is in fact a risk, clear and present danger. And as the CMO said in her report, the numbers are not encouraging. We have to take extra precaution going into this holiday week, where I know a number of Jamaicans would have planned activities, and many are, you know, having a difficult time determining whether to abandon those activities, scale down. It really is a tough time. And I just want to say on behalf of the public health team and indeed the government, we understand, we fully understand, we fully appreciate. But, you know, public health, your health is always going to take precedence over other things. This independence could represent a turning point in the COVID fight. We want to make it an event for vaccination, not necessarily an event for too much festivity and crowd gathering, liberating ourselves from the chains of the restrictions over time, sending that strong message by going out and getting vaccinated, and observing the protocols where we have to. We look forward to tomorrow's arrival, and we thank the UK government for the support, and we look forward to the next number of weeks and months, because our focus now is going to be heavily on getting the vaccine to the people in the communities. To my colleague, Minister Mackenzie, who came on and who has been very supportive and will do more of that, along with the members of parliament, councillors, mayors, the private sector, and of course, last but by no means least, the public health team. I really want to express my appreciation to all for this collaborative effort. Let us go out, let us get vaccinated, let us encourage, and let us drive another blow into the response to COVID as we move back to normal and get back to life. Thank you very much. Have a good evening.
Booking your COVID-19 vaccination appointment is simple. Use one of two options. Option 1. Register using the online portal at the Ministry of Health and Wellness's website. Go to www.moh.gov.jm, click Apply Here for COVID-19 vaccinations, and follow the instructions on screen. Enter your mobile phone number. You will receive a text message with a one-time password. Enter it on the site to confirm your account. Fill in the information requested. Choose your parish and a vaccination center there. Then schedule a date and time convenient to you. You will receive a text confirmation with the details of your appointment. Option 2. You may also book your vaccination appointment via telephone. Call the National Vaccination Center at 888-1-LOVE. That's 888-663-5683. A representative will take your information, book you at the nearest vaccination site, and register your appointment. You now have a vaccination appointment. For your first dose, when going to the site, take your TRN and a government-issued identification or letter from a Justice of the Peace. For your second dose, take to the appointment your vaccination card, TRN, and a government-issued identification or letter from a Justice of the Peace. You may ask a relative or friend to help you book your vaccination appointment. Book your COVID-19 vaccination appointment today. Get vaccinated. Get back to life.
Jamaica's forests, mysterious, majestic, wondrous, life force of nature. A unique habitat for biologically diverse species of flora and fauna found nowhere else in the world. The lungs and breath of the earth, trees in the forest absorb carbon dioxide and breathe out oxygen essential to life, cooling down the planet.